assessment that I'm going to do on my patient. Okay. My name is Yvonne. I'm going to be your nurse for today. I'm going to do an head-to-toe assessment. What's your name?
Mayreli Santana.
Mayreli Santana. Can I see your ID? What's your date of birth?
06/22/1989.
When I do this, I'm looking at the patient's alertness and responsive and level of consciousness. I'm going to go ahead and also I look at the symmetry and I look at the skin. She looks fine and dressed and well grown. Also her age is, for her ethnicity, she's fine. And I'm going to go ahead and start the inspection. Okay, I'm going to go ahead now and I'm going to inspect your head and your
Okay, go ahead.
Okay, while I do this, I look I will focus on the hair. She has a lot of hair. I make sure that there's no lice and that there's no missing hair and that she doesn't have any lesions on the head. Okay. Next, I'm gonna go ahead and I'm gonna inspect the head for the sinuses. Does this hurt?
No.
Does this hurt?
No.
What I do is I make sure the face looks symmetry, the eyes and nose and the mouth. Okay, I don't see no abnormalities. I'm gonna go ahead and palpate the artery. Okay. And can you open and close your mouth, please? And this is the jongo-mandibular joint. Okay. Next one, I'm gonna go ahead and inspect the eyes. I'm gonna go ahead and see that. Do you have? I'm gonna ask the patient if they have any vision problems.
No, I'm 20/20.
You're 20/20. Okay.
Yeah.
Next, I'm gonna make sure. Can you close your eyes for me? I'm gonna check the lacrimal. What I do is I inspect the scleraris Y, and then her eyes. The pupil size is 4, and they're right now at the moment they're fixed in there to me. I'm gonna check for light reflect accommodation now, and I'm gonna dim the lights. Okay. Okay. Her pupils constrict. They react to light. What I do is I'm also checking that the light reflects on the same side and they're symmetrical, which they are. Next, I'm going to check confrontation test. I'm going to go ahead and check her peripheral vision. Can you put your hand on this side, please? Tell me when you see the pen.
No.
Okay. The other one. The other hand. Okay. Tell me when you see the okay. Next, I'm going to check the cortical movements for cranial nerves 3, 6, and 5. Okay. Can you move with the pen, please? Okay. While I do this, I check for the eye movements and make sure there's that the eye doesn't sag or they're moved asymmetrical. Alright. Next, I'm gonna go ahead and inspect the nose. I make sure that there's no I'm going to inspect the skin. There's no bruises, inflammation, or anything abnormal in the nose. I'm going to tell her, I'm going to go ahead and check for pregnancy. Can you breathe in and out? Breathe in and out. Okay. And I'm going to look at the septum and make sure there's no lesion or there's anything abnormal inside. And I'm also going to tell her to smell something. Can you please close your eyes? Can you tell me what is this?
Menthol.
Okay, perfect. Open your eyes. Next, I'm gonna inspect the ears. I'm gonna make sure that they're aligned to the eye. I'm gonna go ahead and palpate them. Does it hurt?
No, I don't.
And if I had an ophthalmoscope stone, I would look into the membrane, and it's fine. And I'm gonna pull back and look at the memory, and it seems fine. Okay, I don't see no drainage and her ear doesn't hurt. Next, I'm gonna go ahead and palpate the mouth. Can you open your mouth? The mucosa, she's moist. She has no lesion. Can you say ah?
Ah.
While I do this, I'm checking for the gut reflex as well, and I'm looking that the uvula goes up, and Can you? And this is gonna be cranial nerve 12. Stick out your tongue. Okay, perfect. Can you frown? Okay, can you French your? Can you put out your forehead with your eyebrows? Okay, and can you like blow? Like can you? Yeah, that's fine. Thank you. Next, I'm gonna go ahead and I'm gonna inspect for cranial nerve 11. I'm gonna tell her to move her head. Can you move your head side to side? Okay. Up and down. Okay, perfect. And I'm gonna tell her to raise her arms against my resistance. What I do is I'm checking for cranial nerve number 11. Okay. Next, I'm gonna make sure for the skin. I'm gonna check her nails as well and check capillary fill, which is less than 2 seconds. Okay, Miss Mireles, can you please move to this side? I'm gonna go ahead and inspect your lungs. Okay. So you mind if I put it off?
No, it's fine.
Okay. Okay. While I do this, I look at the patient's back. I make sure that the spine it's aligned, the skin, and I go ahead and palpate it. Okay. While she leans forward. Okay, perfect. And I'm gonna go ahead and listen to her lungs. Can you take a deep breath, please? Out. Can you take a deep breath in and out? In and out. In and out. Can you say 99?
99.
99.
99.
99. Okay. What I do is I also check for the expansion. Can you breathe in and out? And the rest is symmetrically and then move in with the same distance from my thumb. Okay. Thank you, Ms. Mireles. And we're gonna go ahead and inspect your joints in the hands. Okay. I'm gonna now check the upper extremities. Can you move your wrist? Okay. Can you move the elbow? Okay. I'm gonna check that she flexed the arm. Okay. And I'm gonna can you rotate the arm? Okay. Up and down. And I'm also gonna check for resistance. Can you do it both hands against my resistance? Can you move up, down? Okay. And can you push my hands up and down? I'm checking for strength in your upper extremity, which is fine, and it's 5, both of the upper arms. I'm gonna go ahead and check the neck. I'm checking for the chakra that is midline. I'm gonna go ahead and palpate it. Okay. I'm going to listen to the cardiac artery pulse compared to the radial, which is fine. I'm going to go ahead and listen for any roots in the carotid. Okay, perfect. Okay. Next, I'm going to go ahead and I'm going to inspect the chest. Okay. I'm going to check for any diaphragmitis. And I'm going to listen to her heart sounds. I'm going to listen to the 5 points, which is the aortic, pulmonary, ribs, the tricuspid, and the mitral. Okay, and I'm going to go ahead and listen for any murmurs and abnormality with the bell. I'm going to tell the patient to lean forward to the left hand side so I could listen better to the S2 with the stethoscope. Okay, S1, S2 regular. Alright, thank you. Can you please go slowly and lean back for me? While the patient moves back, I'm going to go ahead and put her at 45-degree angle so I could show her jugular vein pulse. She does have it and I'm able to see it. Alright. Next, I'm going to inspect the patient's abdomen area. Okay. When I do this, I check for a contour. Okay. And I don't see any swelling, any abnormalities. The umbilical, it's symmetrical. And I also chest for the chest size, that she doesn't have a barrel abdomen, she's fine. Next, I'm gonna go ahead and auscultate, and I'm gonna auscultate for the aortic, the renal arteries, the iliac with a bell, and then I'm gonna go ahead and listen for the femur right on the bottom. Okay. Next, I'm gonna percuss, starting on the lower quadrant. Full quadrant, and I'm gonna go ahead and I'm gonna palpate on the lower quadrant, on the right lower quadrant, until the patient. Does this hurt?
No.
Does this hurt?
No.
Full quadrant. Does this hurt?
No.
Okay. Next, I'm gonna tell the patient to breathe in, palpate the liver, in and out, check for tenderness, rebound, pain. Does that hurt?
No.
Okay, just saying no. Alright, perfect. Thank you. Next, I'm going to go ahead and tell the patient to stand up. I'm checking for the strength as she arises. And then I'm going to assess the lower extremities. Okay. I'm going to assess her pulses, dorsalis, the tibial, and then the popliteal. Pedalis, I'm sorry. Pedalis and the popliteal. Okay. I'm going to check the range of motion of all her joints and her legs. Can you move it? And I'm going to check for the resistance against my strength. Okay. Next, I'm going to go ahead. Perfect, thank you. And assess the patient's neurological and sensation. Okay. I'm going to tell her to close her eyes and identify an object for me. Can you please close your eyes? Identify this for me. Okay. Okay, thank you. Next, I'm going to go ahead and check for cerebral function. Can you go like this in this order? Okay, perfect. Patient is able to do that. Can you close your eyes for me? And this is sharp and this is dull, okay? Tell me what you feel.
Sharp. Dull. Sharp. Dull.
Okay. So examine her feet already as well. I check the patient has no edema, no swelling by touching and feeling also her temperature, and measure and compare to both lower extremities that by the calf side that is not inflamed, or there's anything on her abnormally. I'm also going to go ahead and check the reflexes. Okay. Can you raise your leg? Okay. Can you relax it? Put the arms there, sorry. Okay, perfect. Thank you. And that's it. That's my head-to-toe assessment with Yvonne. My name is Yvonne, and this is Morelis, which is also a nurse. And I borrowed her for today so I could do my head-to-toe assessment. Thank you.
Thank you.